Hi, my name is AC. My pre-med course is medical technology and I am currently a first-year pediatric resident. Initially, pediatrics wasn't really my first choice because I always envisioned myself as an internist. But come clerkship and internship, I realized that I really enjoy taking care of kids and interacting with them. And when you're able to contribute to a child's recovery and healing, I realize that it's more fulfilling. When a child recovers under your care, you don't just give them for the meantime, you give them the rest of their lives. And I think that's a beautiful thing. Residency in 3 words: exhausting, chaotic, but meaningful. A typical day in my residency program involves me waking up at around 6 to 6:30 a.m. where I do my stretching to prepare for another duty day, and then I prepare for duty. Our time in is at 7:40 a.m. and then the first 2 hours of the morning is spent doing endorsements, and sometimes there are conferences that we have to attend to. So after that, dun pa kami mag-endorse. And then after endorsements, we have our morning rounds where we handle our own patients. So our status is pre-duty and from. So ideally, from residents, they get off at around 12 noon. But that's being optimistic. And then after 12 noon, the from duty residents will endorse to the duty residents. And then by 5 p.m., ideally, the pre-duty residents will endorse their patients to the duty residents. So in my residency program also, we have patients under our care. But when you're duty status, you handle all of those patients regardless of who is the resident in charge. And then by 5 p.m., the duty residents will have their chart rounds, look at the latest entries from the services, and then eat our quick dinner. And then by 7 p.m., we have our so-called edema rounds, where the first-year residents together with their seniors will do bedside rounds sa lahat ng patients sa ward, where you discuss the case, you discuss the things to watch out for during your duty day, and then you discuss the pendings of each patient. And then usually by 12 midnight, there's some downtime. So that's usually the time na mag-receive kami ng new admissions from the ER, or we do update our census at that time. And sometimes we sneak in a few hours of sleep. That's ideal also. And then by 4 a.m. to 5 a.m., we go down to the wards again, where we do our chart rounds, bedside rounds, update the census, and then in preparation for endorsements by 7 to 8 a.m. And then that's for our ward rotation. But when you're EROPD rotation, our duty is every 4 days. So that's pre-duty from. When you're pre-status, you're stationed at the OPD, but when you're duty status, you're stationed at the ER, where you have your duty for 24 hours. So you're the one who manages the patients in the ER for 24 hours for your duty status. So that's about it for our rotation. The hardest part of residency for me, I think, is finding time for yourself. Because as a first-year resident, you do all the scut work, all the paperworks, all the slides. And apart from that, you also have reports, you have mortality slides, you have audit slides that you have to finish. And finding time for yourself can sometimes be a struggle, because minsan pag umuwi ako after duty, I just die and then wake up the following day where you have to go to the hospital again. And another thing is finding time to study, because we do have our quizzes, Nelson quizzes, and you have to study chapters for that. And minsan hindi mo alam saan isisingit yun. But the most rewarding part of residency for me is, I think, seeing patients graduate, especially the chronic ones who were admitted for months, and then seeing them follow up sa OPD on your continuity clinic. You see how they've improved, how they're tolerating feeding now, they're off oxygen, and you see how grateful the parents are. That's the most rewarding part for me. Advice for those who want to go to med, or those who want to enter residency, I think enjoy the process for now, because when you're a resident, you have bigger responsibilities. But when you're in it for the right reasons, you'll survive. So that's my short but sweet advice.